Welcome, everyone. Good afternoon or good morning, depending on where you're joining us from. My name is Jessie Mandel, and I'm the National Program Director at Healthy Schools Campaign. Welcome to the third webinar in our three-part School Medicaid Matters webinar series, Organizing for Student Health and School Medicaid. I'm so excited for our discussion today. The purpose of this webinar series is to help enhance understanding of expanded school Medicaid so that we can leverage the full potential of federal fundings to support student health. These webinars are designed for you to join at any point, no matter if you are familiar with this topic or you are just getting started to learn more. But before we start today, we know the trauma many schools and students are facing in the wake of the most recent shooting in Tennessee, and the trauma and violence students face in many forms across the country every day. We want to express our gratitude to the incredible people, many on this call today, for your work creating safe and healthy environments for kids. As young people continue to face the trauma of violence inside and outside their schools, we need school health programs to meet the physical, emotional, and mental health needs of our kids. Next slide. We are so grateful to be hosting this webinar series in partnership with two incredible national organizations, Community Catalyst and the Georgetown Center for Children and Families. Thank you to both organizations. And for those of you who are not familiar with Healthy Schools Campaign, we are a national organization working at the intersection of education, health, and equity. We are based in Chicago and draw on our work in Chicago public schools. And we are a leader in supporting sufficient and sustainable funding for school health services, including through Medicaid. Before I start today, I'm just going to review today's agenda. And I think we're getting our slides back up, but I'll just keep going. Okay, thanks. So I just want to mention a few housekeeping items. First, this webinar is being recorded and the slides will be made available after. We'll have time at the end for a Q&A, but as a reminder, at any time you can submit your questions to our speakers, or you can share questions or comments to all participants through the chat. And we'll do our best to answer your questions, or we'll follow up with you after the webinar to answer your questions. So now we can move to the agenda slide because I have the honor of introducing our speakers and reviewing today's agenda. Thanks so much. So we'll start with a brief overview of our webinar series and the opportunity of Medicaid free care. And then Margot Johnson-Green, State Health Policy Analyst with the Georgetown Center for Children and Families, will give an overview of recent federal momentum around school Medicaid. She will be followed by Orla Kennedy, Senior Policy Analyst with Community Catalyst, who will discuss how you can organize and advocate to improve school-based health services, no matter what your role is. And then we'll hear from two incredible experts to talk about what this is looking like on the ground and how they are advocating for student behavioral health services and student health. Becky Hudak is Senior Policy Counsel with Georgia Appleseed. Prior to joining Georgia Appleseed, Becky served as a public defender in Allegheny County, Pennsylvania for 14 years. After 8 years of practicing in the adult criminal division, she was appointed as the director of the office's juvenile delinquency division, where she witnessed how inadequate education supports, particularly for children of color and children with disabilities, resulted in increased contact with the juvenile court system. In 2018, she expanded the scope of the division's practice and ultimately created the office's first education unit to advocate for kids in the school setting. Meredith Teamer is a claims analyst and reporter with the Evanston-Skokie School District 65 in Illinois. Meredith has 10 years experience in the education field in such roles as special education teacher and paraprofessional working for Chicago, Prince George's County, and the Baltimore Public School System. In 2014, she transitioned to the social services sector, where she worked with the City of Chicago homeless veteran population under the 25 Cities Initiative to End Veteran Homelessness. In 2018, her passion took her to Georgia, where she served families through the Department of Families and Children's Services. And recently, Meredith returned to Illinois, where she was offered the opportunity to serve families in District 65. We'll then have a panel discussion with our speakers following their remarks, and then we'll have an audience Q&A, which will be your time to answer questions and ask questions. Next slide. Now, as I mentioned, today is the third webinar in our School Medicaid Matters webinar series, which we kicked off in February of this year. Next slide. In our first webinar, we looked at the youth mental health and substance use crisis and the need for greater access and expanded services in schools. And we heard about recent federal investments and opportunities to address this need from former CMS Administrator Vicki Wachino in the unique moment that we are in for school Medicaid, which I know Margot will be discussing further. Next slide. During our second webinar, we gave a more foundational understanding of how Medicaid pays for health services. We looked at Medicaid's critical role in children's health coverage, especially mental and behavioral health, with half of all US children enrolled in Medicaid or CHIP. And we took a deeper dive into how states are leveraging Medicaid funds. Specifically, we heard from experts in New Mexico and Michigan. New Mexico, which is in the process of expanding their school Medicaid program, shared their lessons learned along the way. And Michigan talked about the impact of expanding and the results they've seen, including how they've been able to increase school providers and draw down approximately $25 million in new federal funds for schools, really highlighting how free care is a key opportunity to increase school health services. So to back up for just a moment, let's review what this free care opportunity is about. For more than 30 years, Medicaid has covered services in students' individualized education programs, or IEPs, which has been a critically important part of how school-based health services have been funded. But historically, Medicaid would only reimburse schools for services provided to a limited number of students, those with IEPs. Then in 2014, CMS made a policy clarification that removed barriers for school-based Medicaid and clarified that schools can be reimbursed for services provided to all Medicaid enrolled students. This policy is known as the free care policy reversal. In the context of free care, it's important to note that we are talking about health services that are provided by school or school district employed providers. There are other models for delivering health services in schools, and these may include community partnerships or school-based health centers, and all models are important and can complement each other. But it's important just to clarify that when we're talking about free care and the free care opportunity, we are focusing on that last category of providers employed by or contracted by schools. So to recap, states now have the option to receive reimbursement for services delivered to all Medicaid enrolled schools, all Medicaid enrolled students in schools. But it's up to states to decide to expand. And that decision will involve different stakeholders in making this choice, including Medicaid, the Medicaid department, the state education agency, and sometimes the state legislature or governor, but not always. Once a state has decided to expand its school-based Medicaid program, it must look at its existing Medicaid state plan to determine how best to move forward. Next slide. So at its core, expanding school-based Medicaid to more students can mean an increase in the amount of federal funding to the state. It's a potentially big and sustainable new source of revenue, which can support more school health providers and services. But what's more, this opportunity, it also allows state Medicaid and education policymakers to come together and think more holistically and strategically to improve student health and education outcomes together. So here you can see which states have expanded their school Medicaid program or in the process of expanding. Those are the light green ones that are in the process. And even if your state is one of those white states, there are probably some conversations or advocates looking at this option now for your state. So now I'll turn it over to Margot Johnson-Green, who will talk about the recent federal momentum for school Medicaid and why we expect to see more states to be turning a shade of green very soon. So Margot, over to you.
Thanks so much, Jessie, and welcome again, everyone. As I'm sure you are all aware, there's been a flurry of activity at the federal level over the past year, no doubt due to the physical and emotional toll that COVID has had on students and educators, as well as the financial impact that it has had on school districts. The Biden administration has made a clear commitment to supporting school students and educators, has emphasized the role that Medicaid plays in keeping students healthy and supporting school budgets, therefore shaping this watershed moment for school Medicaid. In July 2022, the Bipartisan Safer Communities Act was signed into law, which contains several provisions relating to Medicaid and how Medicaid can provide access to healthcare services in schools. Most notably, it established what Vicki Vicino referred to in the first webinar in this series as the school Medicaid trifecta, and which I have humbly attempted to recreate on the left side of the screen. It required updates to the 2003 Administrative Claiming Guide and the 1997 Technical Assistance Guide, and it has been to help reduce administrative burden on districts who want to administer health services and receive reimbursement for Medicaid covered services. Additionally, the Bipartisan Safer Communities Act also mandated the creation of a technical assistance center to build capacity and provide resources in Medicaid agencies and districts, and provided $50 million worth of grants to go out to states to help implement this assistance and planning grants. Right now, we're hoping to see the new guidance come out this summer, and for more information on the TA Center and how planning grants will be dispersed shortly afterward. Following this then, in August 2022, CMS released an informational bulletin giving everyone a taste of what may come in the new guidance. While the informational bulletin did not provide any new policy, it did clarify existing options that states have to leverage Medicaid to support school-based health programs. Next slide, please. At the same time, all of this is happening in the midst of the unwinding of the continuous coverage provision. As background, at the start of COVID-19, public health emergency, protections were put into place that prevented Medicaid enrollees from losing their coverage. This is what's known as a continuous coverage provision. During this time, renewals were halted and no enrollee could lose coverage, even if they hadn't achieved an income, household size, or non-payment of their premium. However, earlier this year, the Consolidated Appropriations Act set an end date to the continuous eligibility provision, signaling the beginning of the unwinding. Starting March 31st, 2023, all Medicaid enrollees will have to have their eligibility checked to ensure that they are still eligible for coverage, meaning that right now we are in the unwinding. This unwinding period will last through May 2024, but some states may choose to finish their renewals before then. In fact, we've already seen 5 states that have started their disenrollments this month, the earliest that would be possible too. And as you can imagine, the unwinding of the continuous coverage provision will be a major undertaking for state Medicaid agencies over the next year, as nearly 83.5 million enrollees will have to have their eligibility checked, including 34.2 million children. It's imperative that states do all that they can to ensure continuity of coverage during this time. It is estimated that nearly 6.7 million children are at risk of losing coverage, and that the uninsured rate could possibly double. All that being said, we will not quite put up the alarm bells just yet, as a lot of time and planning has been put into making sure that children and families don't unnecessarily lose coverage during the unwinding. And if we can go over to the next slide, I can review some of the resources that have been created in preparation for the unwinding. The first on this list is CCF's 50 state unwinding tracker, which shows all of the materials that are available to the public from 50 states in DC for the unwinding. And this includes things like the unwinding plans, communications toolkits that states have created for advocates and other stakeholders to use to let enrollees know that the unwinding is happening. It also includes renewal reports, so how states are planning to distribute their renewals over the unwinding period. and it also contains other materials. So this 50-state tracker is a great resource if you want to know what your state has prepared for the unwinding. Additionally, there is also a school-specific unwinding communications toolkit that is the third bullet on this page. And that was created in conjunction with AASA and CBPP, and that contains things like a script that school districts can use to send out to families, a letter to school district leaders to explain background on the unwinding, and some social media materials as well. Next up, we also have a brief on the Medicaid and CHIP provisions in the Consolidated Appropriations Act, and that also includes information on the unwinding, such as some of the data reporting requirements that are mandated for the states to help advocates and other stakeholders monitor disenrollments during the unwinding. And lastly, the newest resource, I think, on this list is data tables on Medicaid and CHIP coverage by school district. So if you wonder how many kids in your school district are covered by Medicaid or CHIP, those data tables are up on the CCF website. And that is a great resource to sort of understand the scope of the unwinding and how other federal actions such as the TA Center and the planning grants might impact your school district based on how many students are enrolled in Medicaid and CHIP. And that is it for me. So I will now pass it off to Orla to get us started on the focus of today's webinar, which is organizing and advocating for school Medicaid.
Thank you so much, Margot. That was wonderful. Hello, everybody. I'm Orla from Community Catalyst, and we're a national health advocacy organization dedicated to building the power to create a health system rooted in race equity and health justice. And I specifically work on our advocacy related to substance use disorders. And we advocate for public health responses to substance use instead of punitive and criminalized approaches. And so one of those key areas that we focus on is through youth prevention and early intervention in schools. And so that's the perspective that I'll be bringing into today's discussion, and really excited to be here today to be continuing this series on school Medicaid. Yes, on to the next slide, please. And as we heard just now from Margot, there really is significant federal attention to strengthening school-based Medicaid right now. And on deck to come is this new updated guidance, these grant announcements for expanding and strengthening school-based Medicaid, as well as the Technical Assistance Center that's going to be funded specifically for assisting states in the processes of expanding their school-based Medicaid program. So really it's time for state and health advocates and others who care about children across their state to lay the groundwork to be able to take advantage of this moment to make sure that youth across the states benefit fully. So yeah, there's the guidance, the grants, and the technical assistance, and Margot gave a great overview of those earlier. On to the next slide. So this is really the question that we're exploring today. So how can we as advocates across the country leverage this moment to improve student health? And I'll share some overarching considerations that we have, and then we're going to hear from our speakers from Georgia and Illinois to share their experiences on the ground. Next slide, please. And so really, like any school health improvement or sustainability effort, or really any push for change, policy change in general, it's so essential to engage stakeholders. And this is probably familiar territory for folks on the call here, but it really is good to start now even engaging a coalition of relevant stakeholders who can help make this case for comprehensive expansion of school-based services. So we recommend including youth and school-based providers and teachers and parents and child health advocates, mental health advocates, substance use disorders advocates, education and special education advocates, and really others from across your state who are invested in and care about young people and their health needs. And in particular, we recommend you consider engaging a youth advisory council or a youth advisory board, just to make sure that in the advocacy and in the planning and in the scoping out for these expansions and strengthenings of school-based Medicaid, that it's done really centering the youth experience and the youth voice. On to the next slide, please. And I really want to emphasize this importance of youth engagement in this process. Our team works, our Community Catalyst, we work with a youth advisory board to inform our advocacy. And our goal really is to engage their experiences and their priorities through every stage of the policy advocacy process. So including our advocacy for better school-based health programs. So similar to the Nothing About Us Without Us frame, as I'm sure many of you have heard before, that's rooted in the disability rights community and the recovery community. And so this quote here is an excerpt from our youth board's policy agenda, and the whole agenda is powerful, and it's linked here in the slides. So the whole agenda is powerful, and this whole excerpt is powerful. But for me, I kind of shared this as a reminder for me and for all of us to continually be mindful that all of these conversations about strengthening school-based Medicaid programs and improving them is really rooted in the real lives of young people. And so just to share some of their recommendations, and this is from our Community Catalyst Youth Advisory Board, some of the themes that came through: we can no longer tolerate an education system that punishes students, and particularly students of color, for behaviors that are often rooted in toxic stress, trauma, and mental illness. We need compassionate educators who see us as whole people and who understand how experiences of trauma and oppression can impact our ability to learn in the classroom. We need school programs that lift students up and normalize talking about mental health and substance misuse. And of course, when we're talking about school health, we're talking about behavioral health and more. And this is specifically what came through, though, in the recommendations from our Youth Advisory Board when it comes to school-based programs for mental health and substance misuse. So yeah, they're amazing, inspiring group of people. So on to the next slide, please. And another a consideration really is to identify what are the specific improvements that are needed in your state to improve the school-based behavioral health care in your area. And so we know every state is different, and we know that every state Medicaid is different, every state Medicaid program is different. So a really important first step is getting a sense of what's currently happening in your state when it comes to school-based Medicaid and what could be improved. And so a really great resource is from Healthy Schools Campaign, and I meant to put this on the slide here, and I'm sorry that I didn't, but I'll put it in the chat right here. But this is a resource that provides an overview, a state by state, of all of the state Medicaid programs, of school-based Medicaid programs across the country. So this is a great snapshot to get a sense of these key questions. For example, does your state already allow Medicaid reimbursement for school-based health services for all Medicaid enrolled youth? We heard Jesse in the beginning explain the importance of the free care rule policy reversal. And at the same time, not all states have taken advantage of that yet. So similarly, who is delivering services in your schools and not currently getting reimbursed by Medicaid, but could be? And what health services are not being provided to schools, in schools to all Medicaid enrolled children, but could be? And so these are sort of the foundational questions to be looking at, and then building the momentum to leverage this federal opportunity to then make the improvements in your state. And we recommend referring to Michigan as an example of a really great comprehensive state plan for expanding school-based services. And there's a lot of other great state models as well. The next slide, please. And so in addition to the youth and stakeholder engagement I mentioned earlier, we really recommend specifically engaging your state Medicaid agencies and state departments of education now, and making sure that they know that these federal resources are coming and that it's time to get ready. So really identify and engage with the state officials who specifically work on school Medicaid policy in your state. So there's likely a person in the Medicaid agency as well as in the education agency who is highly invested in this issue. And for some of you, this might be very familiar territory for you. So this is nothing new. But so these folks who are laser focused on school Medicaid policy might need your support convincing the state Medicaid director or maybe the governor to make the policy changes needed to expand school-based services and take full advantage of this federal opportunity. And so some of the things to make sure they know about are the updated guidance that's put out, and then making sure that they know that the grant funding is going to be coming, and all of that to make sure that it's on their radar. And the next slide here, so really just to learn more, the things that I just outlined are presented in this advocacy tool. Advocacy tool helps school-age youth get the behavioral health care they need. And that goes through some of these recommendations with a little bit more context. And then if you're interested in specifically looking at the financing angle, I encourage you to take a look at this recent presentation that we did with one of SAMHSA's technical assistance centers that is specifically focused on the financing of school services, school-based health services. So with that, I am going to turn it over to Becky in Georgia to share about their on-the-ground experiences on this topic.
Thank you so much, Orla, for that presentation. Hi, everyone. I am Becky Hudock. I am Senior Policy Counsel at Georgia Appleseed. Georgia Appleseed is actually one of 17 different Appleseed sites throughout the nation. Every Appleseed focuses on a different issue. And right now, one of Georgia Appleseed's primary focuses is school-based behavioral health, but it wasn't always that way. And I want to talk a little bit about our history, so you know sort of the work that we did that informed our opinions and our advocacy on school-based behavioral health. So we were started in 2005. We were founded by a former juvenile court judge here in Atlanta. And when we first started, we focused heavily on what was going on in the schools. And we know, as my own experience as a juvenile justice advocate, that so much of school discipline and the way that the adults in the schools were reacting to children the response was to send them to juvenile justice and to discipline them. And so Appleseed's initial activities were focusing on expanding school justice partnerships and school climate committees, and then working with the Department of Education here in Georgia to expand PBIS programs across the state. So a lot of our work was going from community to community, region to region, in partnership with the Department of Education, and introducing PBIS programs that they could implement with fidelity. We then moved on to another project in partnership with our state DFACS program, where we began providing representation to children in foster care that were facing school exclusion. And it was through this work that we realized that almost every child we represented that was in the foster care system had experienced trauma, is experiencing trauma. Being removed from your home is one ACE. So we realized that schools can do so much more to work with the student population, to provide services, not just for kids that have a diagnosis, but tier 1 and tier 2 services were critical. We realized with our foster care work that as kids were being moved from home to home, there were a number of barriers of access to mental health care. Many foster care parents work full-time, regular parents work full-time, and it was increasingly difficult to make sure our kiddos could get services unless they were being provided where they were every day, and that's in the school. Additionally, we realized, I'll talk about the APEX program in a moment, but that comprehensive school-based mental health services and behavioral health services improve school climate, improve attendance, and improve the likelihood that a child is going to graduate. So those are where we came to our school-based behavioral health programming. So next slide. So when we moved into our school-based behavioral health advocacy, what I would say for Georgia Appleseed and what I would say for any advocacy organization is you can't do it alone. You need to find those partners throughout the state and the community that can help move the needle. And we have 2 absolutely amazing school-based behavioral health collaborative partners The first one being the Carter Center. The Carter Center works both within the state of Georgia and internationally on mental health programming and school-based behavioral health advocacy. Their convening power is second to none, and they've been a wonderful funder of a lot of our efforts and other efforts by other organizations in the state, including Voices for Georgia's Children, who has been doing amazing work on the ground, advocating awareness for youth mental health programs. One of the things I'd like, if you have time, is to go to the Free Your Feels campaign, which is a digital campaign by Voices for Georgia's Children that spreads awareness and advocacy for youth mental health. And it is focused at both the youth level and a student and parent teacher level. So it's a really wonderful campaign. If you want to check that out, it's freeyourfeels.org. Voices has also put out other resources, including a case study of various successful school-based behavioral health programs in Georgia, and I'm going to reference that later, but I just wanted to note now that both of these partners have been critical in the success of school-based behavioral health programs across the state. So next slide. So I want to talk about the Georgia Apex program, because we can advocate all day, but what really works best is if there is a local homegrown success story that we can point to. And for Georgia, that is what is now the Apex program. But what happened was, in the beginning, the origin story was one of our community service boards, our Medicaid providers, partnered with one of the local juvenile courts to both screen and then link those youth up with the mental health services that they needed. And lo and behold, it was a success. And the Gwinnett County superintendent realized the success of a screening and linking program and invited the community service board, Viewpoint Health, into the school to replicate that model within the Gwinnett County school district. And of course, it was successful and kids were getting what they need. So between a collaboration that was working well and an advocacy community with Georgia Appleseed, with the Carter Center and Voices, we were able to go to the state legislature and get state funding and appropriations for what would become the Georgia Apex program. The Apex program is actually administered by Georgia's Department of Behavioral Health and Developmental Disabilities. It works to increase capacity and focuses on children K through 12. This started in the 2016 to 2017 school year. When it began, the state of Georgia actually appropriated $4.6 million to help stand up the program. In this year's fiscal year, it is now up to $5.6 million to support school-based behavioral health programming. The Apex program partners local community service boards and Medicaid providers with school districts to provide these programs at 700 schools across the state, over half of them in rural Georgia, which is incredible. Medicaid and managed care account for 84% of billable services for students. The reason that state funding is so critical and important is because that state funding will then cover those services that are not billable to Medicaid. And it also helps to stand up and do the technical assistance for all the programming. So as you see here, teacher consultation and classroom observation and consultation are 43% of Tier 1 services that are provided by Georgia Apex programs. And then individual and group therapy account for about 46% of those programs. So next slide. So what I would say about school-based behavioral health in Georgia is that the Apex program is remarkable and has been so successful. And part of the Apex programming and why it's been successful is that there's an evaluation component. So we know what it's doing for schools and students across the state. Unfortunately, they can't be in every corner of the state in every school. And we also know that in a state like Georgia, everything is very local. So an Apex program or a school-based behavioral health program that works in the largest school district in the state might not work in rural South Georgia. And so there need to be other options. And so that's why Georgia Appleseed actually developed our two most recent resources that I'm sharing right here. The first is establishing a school-based behavioral health program. This resource recognizes that a behavioral health program in a school looks like something different depending on the community where it is based. And so what we've done are taken the different models of programs and just broken them down into 4 larger categories. We've addressed funding issues for each type of model and program. We've addressed the gold standard of school-based behavioral health and how to even begin advocating for a program in your community. Finally, we tackle some of the legal issues that are still outstanding and concern folks around school-based behavioral health, including the issue of parent consents and also student medical and educational record privacy. So I would encourage you all to go to georgiaappleseed.org and you can download a copy of the school-based behavioral health program. The second resource that we have is the Certified Peer Specialist program. So in Georgia, Certified Peer Specialist Youth and Certified Peer Specialist Parent, both can be, their services can be reimbursed by Medicaid. These specialty practitioners are a wonderful resource for folks raising children with behavioral health difficulties and for youth experiencing behavioral health difficulties. And this resource walks schools and peer support organizations and how to successfully partner and build those partnerships in the community. That's enough for me right now, and I will pass it off to Meredith Teamer up in Evanston.
Good afternoon, everybody. So I am the last person speaking and presenting, and I am here to talk to you guys about basically what it looks like from ground zero starting this process. So just to share a little background about Evanston, Skokie District 65, we have 10 K through 5th grade schools. We have 3 middle schools, 6th through 8th. We have 2 magnet schools that service kids kindergarten through 8th. And we have 3 educational centers. And when I started this Medicaid process, we were invited in the fall of last year through Healthy Schools campaign to be a part of the cohort, the second cohort in Illinois. The first cohort, they had started this process and we were part of the second cohort. I was only 6 months into the role. So this was definitely a new embarkment for me, but I will say the support from Healthy Schools campaign really assisted with the outline of how to get this started for our district. So I just want to share some really quick highlights of our beginning steps, and hopefully will help you all that have not started this process, and to you all that have already implemented this process in your districts and in your states. I mean, great job, because it can be challenging. So like I said, we started in the fall. We first started with an action plan. The action plan was the most intricate part because it really gave us an outline of where to start. I will say, definitely, it can be overwhelming. Never stop thinking big picture, but please take it step by step. Don't think that this is an overnight process. The way we started is definitely getting leadership in our financial office, business office involved in the process to let them know where we were in the process and how our outline of how we wanted to take things step by step. We do have a quarterly mapping of what we want to address each quarter instead of a yearly map, because that can be overwhelming as well. Another thing is working with your other local districts in Illinois, collaborating, see what works for them. We all know about the random moment in time study. That can be challenging, especially for larger districts, to get those percentages right. I collaborated with other districts to see what they do in their districts, because that is an attainable situation for your district. That's something that you can control. And that's one thing that our district focused on, the things that we can control. Because right now our SPA has not totally been approved yet. So we're not full force in it, but we want to be prepared. So when we are approved, we can just start things rolling and everything can be seamless. The next thing is to also collaborate with your local nonprofits and social service agencies, because as everyone has spoke of the unwinding, that is going to be a jarring situation for a lot of our families. A lot of our families, especially in Evanston, they did not know the process of Medicaid. Medicaid, you typically in food stamps or any social services is a renewable system where you have to renew every 6 months or annually. A lot of them started receiving Medicaid during the pandemic, so they never had to abide by those guidelines. So us as a district, we may not be prepared to give everyone the ins and outs and help people renew, but us partnering with nonprofits and social services in our areas can help, where we can give that soft handoff instead of just saying, you know, I know there's a agency in my neighborhood, I'm going to find it for you. No, collaborate with them already so that we can give people resources in real time. Lastly, like I said, it's very important to have the buy-in of your leadership, your school superintendents, where they can advocate for you in rooms that you cannot advocate for yourself. Because I am, you know, I consider myself a frontline worker, so I may not make all the decisions, but really advocating and being prepared and being knowledgeable and using the resources, especially that Healthy Schools campaign provided for our district. I can then go into those rooms and share how our plan is. But I lastly like to say, always think big picture, because for Evanston, our big picture is to have school-based behavioral programs, also to provide other health resources for kids that may not be able to go to the dentist or to the doctor. So to have those resources in the school, and those are our big picture, but our small picture things, like I said, are things that are definitely able to control. And our main goal is for our documentation and our random moment in time study percentages to be, you know, to work on those throughout this year. And we have improved since September of last year. Our percentages have improved because we worked on the attainable. So that's all I have to share.
Thank you so much, Meredith. That was terrific. And Becky, thank you both so much for sharing your insights and your perspective on this. So now we're going to have a panel discussion before we open it up to audience Q&A. So I'll invite Orla and Margot to come back on the screen too, and also welcome Ann Dwyer, Associate Research Professor with the Georgetown Center for Children and Families, who will be joining us for the panel discussion as well. So let's start. Well, actually, before we dive into the panel discussion, I just want to take a moment to frame it up, because we know that many people on this webinar today might not see themselves in those traditional advocacy roles, but we're really here to emphasize that we all play a role, and we all play a role in getting involved. So, Becky, with that, let me start with you. And just to ask you, what kind of tips or tricks would you have for getting started in advocacy for student health and student behavioral health services, recognizing that we're all coming to advocacy from a different starting point?
Thanks. So I guess the first thing I would say is data. if you can get your hands on it. So Georgia has the Georgia Student Health Information Survey. And it is anonymous, but it's also capable of being broken down by school district, which is wonderfully helpful, because that data can inform the power brokers why it's needed. But I think my position is more important than data are personal stories, ways that maybe mental health or behavioral health services have helped you individually, helped your child. If you've experienced a successful school-based behavioral health support, sharing those personal experiences, because I believe those experiences, whoever you are, wherever you come from, actually move people. So that would be my advice.
And I love that, the data and the stories, and also when you spoke, just knowing the history of how you kind of got to the advocacy decisions that you've made, I think was really powerful to hear too. Meredith, what about you? Do you have any tips or tricks that you would like to add, you know, especially given your role kind of inside a school district and advocating from within?
I would definitely say the first part of being an advocate is to advocate for yourself. Don't ever second guess yourself and your ability. And I'm saying that because I have a great supervisor that gave me the autonomy to sort of run with this Medicaid expansion. And like I said, the support from Healthy Schools campaign giving me an outline, because honestly, I didn't know where to start. So having that freedom to talk to my supervisor and say, hey, I think that we have to get ahead of unwinding before it happens. So she gave me that autonomy to provide our superintendent and our deputy superintendent with a presentation of what unwinding is and what it may look like for our district. Because of course, we may have to use some resources, some financial resources before our SPA is approved. So to get them on board and for them to understand what that may look like for our district, and to put that sort of bug in their ear so they know that what's coming down the pipeline. And I just find when you get ahead of that and when things actually happen, it's not a surprise and you're more supported than just sort of on the whim bringing this up like it never happened before.
Got it. I love that. Yeah, and getting ahead and keeping a bug in people's ear, I think are both really important pieces of advice. Orla, what about you? What reflections do you have based on what you heard from Becky and Meredith, based on the work that you've done and thinking Community Catalyst has done in this area?
Thanks, Jesse. Yeah, I'm thinking I would love to hear more about the partnership engagement, Meredith and Becky. Yeah, so in your advocacy, what were the types of partners that you are working with now, or you were in the past, that you were just really glad to have at the table, that they proved really critical to moving the work forward? Becky, would you like to start?
So certainly the partners that I already mentioned, Voices and the Carter Center, again, I can't go on and on enough about their advocacy and partnerships. But the different partnerships that are not as big and well known are those little partnerships on the ground in the communities where we're trying to spread school-based behavioral health. We know there's a lot of stigma attached to behavioral health services. We know there's a lot of distrust with both mental health services and sometimes school systems. So partnering with local faith communities, or even in one circumstance, we have a partnership with the Alphas, which are historically African-American fraternity. In their communities, they are leaders, they are mentors. They have invited us to their table to talk about our efforts, but it's finding those local stakeholders that just carry weight because of who they are and what they've done in their communities.
Yeah, and for District 65, so toward the end of the year, I was invited to monthly Zoom that we have with our partners just in Evanston in our Northern Cook County continuum of care. So in that meeting, I was able to share with them sort of what our unwinding would look like, what is unwinding. And we had volunteers from those community groups to say, hey, you know, when you have parents or families that are struggling with unwinding, you can refer them. So because our superintendent has shared, and we don't really want to get involved with people applying or recertifying for Medicaid, but we did want to provide them with, like I said, some real-time assistance. So that's one of the first things that we did. Also, I work with closely with one of our social workers in the district, and she's like She was born in the district and participated in schools in the district, works in the district. So she is just like a tool and just knowledgeable about everything. So she works with our part of one of her caveats of her position, she works with our homeless students. So in turn, and with that, she's on the radar of understanding unwinding. So it's just the collaboration and just realizing that you've got to like really get out there and talk to people so that they know what's going on, and realizing we already have a lot of the resources within our district already instead of searching for them.
Ian, since you're joining us in this panel discussion, do you have any reflections? I know that both you and Margot work so closely with states on advocacy as well. Any thoughts or questions that you want to lift up now too? Before we
Thank you so much, Jesse. I think one thing that came up both in some of the Q&As in the chat and that our panelists raised was this kind of conversation about school-based providers and working with community providers. So I know in Georgia, for example, the APEX program, it's really a community provider-based program. Meredith, what you're really talking about is kind of a school-based provider program. I don't know, Becky or Meredith, if you can just talk a little bit about how those relationships are maintained. I think sometimes we hear maybe there's some tensions between the school providers and community providers. At the same time, I think when we hear about the APEX program, it's a community program that's coming into the schools and is working really well in a lot of places. So we'd just love to get a little bit more insights from you all about how you're navigating that school provider, community provider relationship. I don't know, Becky, if you want to kick it off with the APEX example.
Yeah, I guess this is like always going to come back to like, this looks like something different in every community, and every community we approach, we try to do it respectfully and thoughtfully. And so I'm not going to engage a district in what is the best for them, because I'm not there to tell them what to do. You just have to explore the possibilities that may or may not work and let them come to their own conclusion. And I really truly think that that's like ultimately the best way to be able to continue to successfully advocate without like getting yourself bogged down in one side of the argument or another.
I just want to share before the meeting, I got a chance to share with Becky. So I actually had the unique opportunity prior to working with Evanston. I was in Georgia working for the Department of Family and Children's Services. And I actually got a chance to see how Medicaid expansion works in the schools. So I'm using some of that knowledge to bring it to my district. Even though we're in the beginning stages, that's where my big picture idea comes from, because I service families in Forsyth County, Georgia, which is a little bit more of a rural area than Metro Atlanta area. And so they are limited to resources. So we were able to work with the school system to provide therapists and therapy through school in the school. And they were able in turn to use Medicaid expansion dollars to pay for those services in the school, because there were a lot of caveats to why we weren't able to provide services to kiddos like outside of school hours. It could be transportation. It could be that the providers were over 20 to 30, 40 miles away where we couldn't get transportation services. So they had to be provided in the school. So I'm bringing that idea to D65 that, okay, once we get those dollars, if we have a kid like this on a 504 plan but that has tremendous trauma, we cannot get reimbursed right now because they don't have an IEP, but through Medicaid dollars, they have a 504 plan that definitely says that they need some type of assistance, some type of therapies. We can offer that in the school setting instead of in a community base, because they may not be able to have the resources to get to those community services at that time.
Thank you, Meredith. That was great to think about how all those pieces fit together too. I'm going to pivot us now to our audience Q&A. So we'll have time, I think, for just one question because we are almost at the top of the hour. We have just a few quick resources to close us out with as well. But Let's start, and as a reminder, we will absolutely be following up with people individually with your questions if we were able to answer them here. But there's one question that I think we came through that would be a good one just to lift up, which is what kind of pushback have you got, and how have you dealt with that? Sometimes Medicaid can be a tricky topic in some states. And sometimes it's just advocating for these resources within the school. So Meredith, I'll start with you since we've been just to mix it up, and then Becky will turn over to you, which I'm sure you have some thoughts on.
So our pushback may look a little different than what you would think pushback looks like. Our state of Illinois is a great state, but you know, this is new. So we do face a lot of people within our ISB, which is our state school like board and system, where they don't really understand what this is going to look like for districts. So the buy-in from them, the advocacy in our state government, it's there, but no one knows what it looks like. So as we're learning, they're learning as well. And then as I spoke to one of those attainable, controllable things, a random moment in time study. It's a big thing for our reimbursement. And just to get our staff's buy-in with that, because it's still some unknown about it. We have new staff that starts and they don't know what to do. So just staying on top of that, that's the sort of form of pushback that we get.
Yeah, so obviously in Georgia, we don't like to mention the M word all the time. But ultimately, Appleseed's role in school-based behavioral health advocacy is not really to get into the weeds with the Medicaid argument. We reserve that honor for our friends at the Carter Center and some of our friends at Voices. But what we do at Appleseed is always focus on the outcomes and the success stories and the kids and just repeating it over and over again. And you know, I think that's been successful for us.
Great. Thank you both so much. Thank you all. I know we could just keep asking questions forever, but we're almost at the top of the hour. So I'm going to just go through a few quick slides now as we wrap up, and we'll be sharing all of these terrific resources after the webinar as well. But just to quickly mention a few highlights that came up, next slide. Healthy Schools Campaign hosts the Healthy Students Promising Futures Initiative, which brings together state teams to develop resources around expanding school-based Medicaid programs. And so this map, which we'll be sharing, has a wealth of information to explore and help get started in advocacy around expanding school health services or strengthening your existing program. Next slide. In addition, we have some other great resources, including the toolkit that Orla mentioned, as well as the hot off the press Medicaid and CHIP coverage by school district from the Georgetown Center for Children and Families. Next slide. So once again, I just want to thank you all. Becky and Meredith, thank you so much for joining us today. It was really fantastic. Just really appreciate you being here. And I also hope that you'll all continue to follow us and stay connected with Healthy Schools Campaign, Community Catalyst, and the Georgetown Center for Children and Family. While this wraps up our three-part School Medicaid webinar series, we'll all be continuing to offer more resources and webinars to continue the momentum for school health and school Medicaid. And finally, we are so grateful for all of you for being here, for joining us, so that together we can continue to advocate so that all students can stay healthy, stay learning, and thrive. Thank you all so much. Enjoy the rest of your day.